So we're going to talk about, do the overview, talk about the impact on consumers, employers, and health plans today. For every dollar the federal government spends, 40 cents of it is borrowed money. It's borrowed money. We spend $661 million each and every day just to pay the interest on this debt. Now this is critical because healthcare is a huge part of that, but before we talk about healthcare, here's the graphic that extends this out, tells us what's our economy going to look like and what the burden of the debt will do to us in the out years. Right in the middle between the gray and the red, we're at 2011, and this is, there's no particular reason for picking 2011, except that it's a demarcation of what's going to happen with the compounding of the national debt over time going forward. As you can see, this is crushing, and that assumes that nothing changes. And that includes, when I say nothing changes, that includes that we don't add to it. That means that we don't further add to the national debt. If we add to the national debt, that thing becomes even worse. Health spending, this graphic kind of gives you the relationship of health spending to all of that. And so we're looking at health spending as a percentage of the gross domestic product. I think the thing to see is that today we're spending about 17.4 or 17.6% of our income, of our gross domestic product on health care. But if you extend out to 2019, that's 19.6%. By 2020, if nothing changes, we're going to be spending 20% of all of our money on health care. By 2025, that number goes up to 25%. A full quarter out of every dollar in our economy will be spent on health care. That's unsustainable. And this is what it looks like in terms of dollars. And you can see the trajectory. The whole point of these charts is to let you see, where we've come from and the direction we're heading. This is not a good trend. This is not a place to be headed, not the direction to be headed in. This projection takes us up to 2011 at $2.7 trillion. But we're a lot higher than that, unfortunately, now in the economy. And it's only going up. It's only going up. This is what it looks like per person, per capita, how much we're spending per person. Again, back in 2011, we were a little over $8,666 per person. You can see, again, the trend is just getting higher and higher. And that's because of the rise in healthcare costs and the rise in healthcare cost premiums. And we'll talk about some of the reasons for that, or behind that rise, a little bit later. Now, I threw this one up because it takes some of the major, it does a comparison between how we do compared to some of the other major industrialized nations as far as per capita spending. And again, we're all the way on the right. We're the tallest bar. So you can see we're spending, how much we're spending. This takes us only through 2008. The orange is private pay, and the green is public pay. You can see where we are stacked up to the rest of the countries. Now, the reason why that's important is this. Someone a lot brighter than I said, healthcare in America is like Dickens' Tale of Two Cities. It was the worst of times, it was the best of times. And the worst of times has to do with this, the inflation. The best of times is no one would argue that we've got the best technology and the best healthcare delivery system almost anywhere on the planet. No one would argue that people come here from all over the world to use our healthcare delivery system. But for 90% of the people, that's irrelevant. But again, the best of times, because 90% of the people just simply need routine care and don't need to be spending, gazillions of dollars to get it. So it was the best of times, it was the worst of times. To further illustrate why that is important is in the healthcare Olympics, and the healthcare Olympics, you take the major races or the major, like in any Olympics, the major events. Two of the major metrics in healthcare is life expectancy and infant mortality. Okay, those are two of the common metrics. Well, if you look at us, if you look at our ranking amongst these countries, where would you guess, I only got, how many I have up here? 9. Where do you think we rank amongst those 9 countries? Say it. Oh, not quite. You're more pessimistic than I am. In the middle. No, that's okay. That's good. Yeah. No, we're about 5th. And our life expectancy is 78 years. I think is adjusted to 78 years. Other countries are doing a heck of a lot better than we are. Our infant mortality rate is also stuck in the middle. So they're spending less, these other countries, and as far as the healthcare Olympics is concerned, they're beating America out, So, you have to have a way of trying to grade what we do, and that's a very simplistic way of doing it. Now, having said that, I always like to do this commercial for California, because I'm proud of California. California, as far as growth rate is concerned, rise in cost growth rate is concerned, does better than most of the large states. We are, you can see the band, we're the yellow bar, and what we're looking at is the average per capita health expenditures, and you can see that we're doing a lot better than other states as far as holding spending down. But nonetheless, healthcare costs rise on average, or have been rising on average, about 6.7% a year. That's what over inflation, 2.5 to 3 times more than the average or the overall inflation rate. Now, healthcare premiums, especially for individual coverage, and even for some group plan employer-sponsored coverage, remain in the double digits every year, double-digit inflation. And so something, this is driving things crazy. And this is what was, and even with all of that spending, some 47 million of our 308 million Americans, or people residing in America, don't have coverage. About 47 million don't have coverage. You can take about half of that amount, add another 22 to 23 million, and we would say that they are underinsured. Okay? So with all that spending, we're still losing a huge segment of the population. And as you'll see when I go into the healthcare disparities next week, you're going to see that people of color and Latinos especially are disproportionately and negatively impacted by that figure. Okay? That'll become real clear, and why and help us understand why this was so important. I only put this one up here for you to look at because it tells you why Obamacare took off. Obamacare took off because of government's skin in the game. And what this attempts to show you is, if you look at the army green segments, of each one of these indices, these bars, that's government's commitment. That's the federal government's commitment through Medicare, Medicaid, and other programs. They're part of their skin. That's their skin in the game. And you can see that is a significant amount of skin. And so the federal government needed a way to curb the cost, or the rising cost of health care, because it was contributing to that crushing debt that I showed you earlier. This was the motive. This was equally motivating as trying to do something about coverage for uninsured people. Okay, now I'm going to move to one of the known wild cards that's simply going to drive healthcare crazy. This is going to drive healthcare crazy. And it started with this woman. She is patient 0. or better still, let me put it another way. She is baby boomer 0. She was the very first baby boomer born. She's recognized as the very first baby boomer in America. Kathleen Casey Kirschler. She was born some seconds after midnight in January of 1945. The baby boomers of 1945 to 1964. You know what happened. The war was over. Men came home. Everybody got pregnant. You know, I mean, that's it. I mean, that's the way. I mean, that's basically what happened. You know, so and she was the first one. And about 3 years ago, she announced that she was retiring and going to apply for Social Security and Medicare. So I just want to put a face on it. She started it all. But here's what the Daily News reported on back at the time when the baby boomers started hitting the age. And you know, this was backed up by research, and they were reporting simply on research. For 20 years, for the next 20 years, from 2011 to 2031, some 10,000 people every single day will turn the age of 65. By 2030, the percentage of the population 65 and older will be double what it was in 2000. That's how significant it is, and you're going to understand in a minute when I tie that to what that does to health care. So we're looking at, we call that America's silver tsunami. That's what's happening. And Social Security and Medicare, the Medicare Trust Fund, which pays for the institutional care for Medicare beneficiaries, is in great, great jeopardy. Let me skip this chart. Let me go here. This is what you need to, here's the correlation. Here's the thing that ties that expanding population to what happens in healthcare. This is the most important metric that we need to appreciate. For every 1% increase in chronic illness, for every 1% increase in chronic illness, we have a 6% increase in utilization of medical care services. Now, what does that have to do with what I just got through talking about with an aging population? When do chronic illnesses start to mature? The older we get, you know, we start racking them up. So the aging population, and so we're talking about healthcare cost containment, and what's the biggest enemy to healthcare cost containment? The aging population. Because of that one metric. For every 1% increase in chronic illness, there's a 6% increase in consumption. When we talk about strategies for dealing with this is why you'll be hearing, if you haven't heard already, the whole idea behind Obamacare, one of the 3 pillars of Obamacare is to keep the population healthy. You know, manage these chronic diseases effectively. Some organizations we'll be talking about them have already started working on that, but trying to keep these chronic conditions. Kaiser has been doing this since Kaiser Health Plan was invented. They got it 50 years ago or so. Prevention, you know, care coordination, care management, keep people healthy because of that. Once they got the chronic disease, it's a fight, it's an uphill battle to try and keep them from keeping healthcare consumption down. Because you're going to need it. You're going to need it when you have the chronic condition. So that's the correlation between age and consumption in healthcare, the enemy of healthcare cost containment. So what does it mean in terms of, you know, we go back to looking at Social Security and Medicare. Well, this is for Social Security. I'm sorry, this is for Medicare beneficiaries. On the left side, you see the number of beneficiaries over time from 1996 projected out to the year 2030. You know, people who reached the age of 65. You can see the trajectory. In 2010, we had 46 million in America. That's going to jump up to 78 million by 2030 because we got 10,000 people every day becoming 65. Well, look at the right side of that graphic. Number of workers supporting every beneficiary. Now, you know how that works, right? The current workers in the workforce pay a tax. They're part of their employer, and the individual pay a tax. And you can see this is going in the wrong direction. We've got more people, the trend is towards more people needing Medicare, and the trend is having fewer workers supporting Medicare. This is why you hear all of the debate in Congress about we need to do something about Medicare. Who was that fellow? Paul Ryan, the former vice presidential candidate. You know, he got it. Now, I'm not supporting anything he's done. Don't get me wrong. A lot of people would shoot me if I said that, but I will say this. As an academic, and I am too, I also teach. I also teach at Cal State University. He identified the problem correctly. It was in trying to sell a solution that was the problem. But you can't fault him for saying he confronted the 800-pound gorilla. If we don't do something about, you know, Medicare and Social Security, if we don't change something, this is going to kill us. This is just going to absolutely kill us. There's no question about that. So here, this chart needs to be adjusted. But this is the hospital trust fund, one piece of Medicare, just the hospital side of it. Through the taxation, this graphic is showing you what's going to happen over time. What that's saying is that the closer we move out towards 2020, the healthcare fund is just going to be depleted. Now, this graphic needs to be adjusted. It says it's going to be depleted around 2018. Well, things have been done, measures have been taken to extend that to 2026. So just move that over to like 2026. But if nothing changes, Medicare goes bust by the year 2026.